This is Dr. Suprava Jena, consultant, fertility specialist at Oasis Fertility, Bhubaneswar branch. So today in this Facebook topic, a live discussion, we'll discuss on endometriosis and its effect on infertility. So before in going to the topic, I would say that I would introduce you endometriosis as a complex disease. Because why I say it is a complex disease? Because the nature of the disease is very difficult to diagnose, and the treatment part is also very difficult, and the symptoms and signs are complex. So entirely we can say that it is a complex disease, and it is a it is a challenge to the clinician, and as well as the for the patients to get treated from this. So, before going, we'll see how does a normal menstrual cycle occurs, and how a patient with endometriosis the cycle occurs. So, in the normal menstrual cycle, usually which is the 28-day cycle in which the endometrium in our body is getting prepared, and the it in this time the uterus, the lining of the uterus, that is the endometrium, forms, and if intercourse is not there and the baby is not getting implanted, this endometrium will shed, at which comes out in the form of menstrual blood. And sometimes the patients with endometriosis, this menstrual blood does not come out and goes backwards towards the tubes, and gets deposited in the ovaries, which leads to formation of chocolate cyst or endometriomas. And it can also go beyond, like towards your abdomen, your pelvis, and gets deposited there. There is a degenerative process of repair, healing, and there occurs adhesions. Everything gets sticked. So there is that leads to formation of adhesion and pain and other symptoms, which I'll discuss to you later. So slides, please. So it is a long-term disease, and the as I said, the it is a complex thing to treat and to diagnose. So when these deposits occur in the ovary and these tubes and abdomen, so this leads to damage of our tubes, ovary, and also the tubal ovarian anatomy. So why does endometriosis occur, and who are prone for endometriosis? So there are many theories that have been given from time and then to explain the nature of this disease, but everything has failed. And but it has been seen that in the young age group patients who are around 25 to 40 years in the reproductive stage, this endometriosis occurs frequently. It can be due to the hormone, that is the estrogen hormone, and there is a hyperestrogenic activity which leads to endometriosis. And apart from this, we have seen, it has been seen that there is a familial tendency for endometriosis in which maybe the mother or the maternal side is affected, from where the genes are carried, and you are prone to get the prone for endometriosis. Apart from this, there may be there may be some changes in the coelomic metaplasia. Everything can be there, which can lead to endometriosis. And but none of the things that is that from this in the scenario, we cannot say there is a definitive reason why the endometriosis has occurred to you, and why this endometriosis is recurrent in you. So but the symptoms, as I have said, the symptoms is difficult and complex. Why complex? It can present to you in the form of mild endometriosis or severe endometriosis. A mild endometriosis patient may not be having may be having very much pain, and stage 4 or high grade endometriosis may not be having any pain, or may remain asymptomatic. So we as a clinician, we have a challenge to diagnose the endometriosis. And if apart from that, there is always a vague symptoms. Maybe there may be a difficulty in defecation, urination. There may be back pain. There may be anything related to difficulty in having coitus, especially if there is a pain after having intercourse. Then we probably suspect that the patient may be having endometriosis. And it has been seen that around 25 to 30% of the patients who have endometriosis, they land up in infertility. So why does infertility occur in endometriosis patient? Because due to the repair degenerative process, that occurs damage to the tube. The tubal motility is affected. The endometrioma, that is endometrial collection chocolate cyst that has occurred, it releases toxic chemicals which damages the normal oocytes. That is normal, the normal eggs are also affected. And apart from that, the egg pickup, while egg pickup during the natural conception is also hampered. So and due to due to painful intercourse, there may be sometimes less coital frequency. So these all can affect then cause it can cause to lead to infertility. So when you present with infertility and go to a fertility specialist for your treatment, then the fertility specialist will order you some test. Like first of all, we'll try to examine you. We'll do a per vaginal examination, per speculum examination, to see if there is a pain, or there is any deposits or any endometrial changes are there. Then we can also do, we order generally for the fertility part, we order anti-Mullerian hormone test to know the egg reserve, since endometriosis damages the normal eggs also. So it is very important to know the normal amount of eggs that are remaining, so that the proper treatment can be planned. Apart from that, to diagnose how complex is the endometriosis, we can do the ultrasound to know the how many endometriosis is there, how much it has been added, and to know the small deposits, small abdominal endometriosis, and any collection in your pelvic pouches. We do the MRI can also be done to diagnose, but the gold standard to diagnose and as well as do any therapeutic therapy for you is laparoscopy. In the process of laparoscopy, we try to also do a dye test to know if the tubes are also okay, and so that any treatment like IUI can be planned. if the tubes are damaged and the number of eggs is also less, accordingly we try to plan the fertility treatment for you. So during the time of laparoscopy, which also if there is a mild endometriosis, there is some adhesion, so the patient is also advised for excision and using cautery, those endometriosis and endometrial collections are removed. And after that, based on that we try to find out at what stage the patient is there. If the patient is already at a stage 4, that is very advanced stage of endometriosis, then the patient, the plan of treatment differs. And if there is a mild endometriosis, the patient can go for natural conception, but but she has to be under a fertility specialist. So if young age is there, mild disease is there, in those cases we can plan natural conception. And if the natural, but the chances in this case of having a pregnancy out of natural conception is remains less. So further, if there is a mild to moderate grade, then we can plan super ovulation with IUI. So what is super ovulation? In these cases we try to give you medicine as well as injections, so that there is multiple growth, not more than 3, multiple growth of your eggs, so that IUI can be planned. So that is called super ovulation and IUI. If all these things fail, then we try to plan IVF for you. So in the IVF process, the we try to first do the egg pickup. But the injections and everything is based on your AMH and laparoscopy finding. We try to see if everything is okay, then accordingly we plan the injections. So injections were given, then all your pickup is done and embryo is formed. And after that we try to suppress the endometriosis by giving you injections and prepare your endometrium for the implantation to occur. And there are also, it is very important to monitor the pregnancy with endometriosis, because these patients, they have a tendency to for repeated abortion, and as well as to develop preterm labor, as well as preeclampsia, and there is increased risk for C-section. Why? Because there is a chance of placenta previa is there. Placenta previa means the implantation of your placenta can occur at a abnormal site. So it is very important to monitor the pregnancy with endometriosis. So we try that the patients should go undergo the process properly and have a healthy pregnancy out of endometriosis. So, with this, I conclude my topic, and I hope you have benefited from this topic. So, further, we can take up some questions if it is there. So the first question is, can endometriosis affect the health of my baby? So it is generally, as per the research, it is not seen, but there is an increased chance of abortion. And because of the toxic chemicals that are released, it can lead to first trimester abortion, but the health of the baby remains normal. And there is a chance that you may have a preterm labor because of the endometriosis. Your uterus may be somewhat stiff to and the body tries to expel the product very soon, so you can land up in preterm labor. But these due to our advanced NICU setups and advances in our medical field, the baby remains healthy in NICU. So as such, the health baby is not affected. The process of the pregnancy is remains complicated. Next question. So next question is, how can I manage my endometriosis symptoms while undergoing fertility treatment? So for if the patient is having severe pain, which is a most common symptoms that we come across, there we try. And if the patient is young, only complaint is pain, then the treatment line differs. But if you are also having fertility issues, then we suggest you to have a pregnancy as soon as possible, because due to the endometriosis, the normal amount of eggs are also getting affected. And if the endometriosis symptom is there, once the pickup and everything is done, we try to alleviate the symptoms and give you some injections in the form of depoprogesterone. And depoprogesterones are there, so that the pain and symptoms get relieved. The uterus is well prepared before the implantation. And during the time of pregnancy, as there is increased progesterone hormone, so it suppresses access the endometriotic focuses, so it doesn't really affect in that time. So next question. Thank you. Thank you for the patient listening.